This is Joe Malone, and we're having a COVID conversation with CG Public Health. On behalf of CG Public Health, Lionel Foster is joining us. Thank you for being here, Lionel.
Well, thank you.
So, since we last talked, the FDA has given full approval to the Pfizer vaccine. What does that mean for people?
Well, it means there's overwhelming evidence that Pfizer's vaccine for people 16 and older is safe and effective, and it carries the strongest possible endorsement from the FDA. So for the unvaccinated, 30% who said they needed full FDA approval before getting vaccinated, you got it. So come on, roll up your sleeves.
Now, we hear the numbers of people being treated for COVID-19 in our hospitals and in the ERs. How is that influx of people affecting others that are needing healthcare for other issues like accidents or medical emergencies?
Well, it's adversely affecting others who have serious health conditions such as heart disease and cancer. It was recently reported that in Iowa, 90% of the COVID patients in intensive care units and 83% of the patients hospitalized due to COVID-19 were not fully vaccinated. So as this new Delta strain spreads out and it's very highly contagious, it's going to take away from those doctors the ability to treat their other patients, and it probably will fill up some of the hospital beds that need to be needed by other individuals.
And by getting a vaccine, you lower your risk significantly, I've heard, of getting severe cases of COVID and therefore keeping you out of the hospital and keeping those beds available for other people.
Exactly, because that's the main purpose of the vaccine, is to keep you out of the hospital and to keep you out of intensive care. So, if you can still get the virus, but it'll be at a lesser impact. And most of the folks that have gotten full vaccinations are not winding up in the hospitals.
We're talking with Lionel Foster on behalf of CG Public Health, having a COVID conversation. Lionel, I see more and more people wearing masks out and about, especially employees at stores. Should I be masking up? And what about if I'm already vaccinated?
Great question. It's important to note that no vaccine is 100% effective, and vaccines alone won't stop the current rapid spread of the highly transmittable Delta variant. People still need to protect themselves even if they have been fully vaccinated. So in that case, if you've been fully vaccinated, you may choose to wear a mask in an indoor crowded activity where you're not sure everyone is vaccinated. People need to decide the level of risk that they're willing to take without a mask on, and particularly those folks who are not vaccinated. They're running a real risk with this new variant coming around because it's highly contagious. And if they catch it, they can pass it on to their friends, neighbors, and loved ones.
Now, just like we're having a conversation here, Lionel, what is the best way to talk to my family about them getting vaccinated, especially now that there is the FDA approval out there?
That's a real difficult question to answer because we've looked at that from all angles, and right now it seems that if they decide they're not going to do it, you can only continue to try and encourage them. But what I recommend, as I talk to my families, that you have to take into serious consideration that the virus is going to continue to go and go and go. There's already a new one out there, MU I believe it is, that may be more contagious than the Delta, and so it keeps building and building. At some point, we may run out of vaccines, and then we're all in trouble.
So it's important to have that conversation.
It's important to have that conversation. It's important to have that conversation regularly.
If you want to learn more about what is being done, where you can go to get more info on COVID-19 and vaccines, cghealth.com is a great starting spot.
Great starting point. And you can call the office and talk to Jeremy Otto, and he can give you all the information you need and all the current information on where we are in Sarasota County in northern Iowa as far as the folks who have been victims of this virus.
Again, cghealth.com. That's cghealth.com. On behalf of CG Public Health, Lionel Foster, thanks so much for coming in and having this COVID conversation.
Well, thank you again.